Now is the time when folks are trying to squeeze out their last dental benefits before they reset in 2020. Here to help us chew on this is Dr. Eric Layton, dentist and managing partner at Trident General Dentistry, and Dr. Melissa Owen, dentist at Trident General. Welcome to you both.
Thank you.
You both have great smiles. I don't see yours quite as much. You have a beautiful smile, Dr. Owen.
Thank you so much.
Well, I appreciate you coming by and telling us a little bit more about what this means to consumers who have a dental plan that maybe have met their deductible, but at this time of year we kind of forget to take advantage of those things. So first of all, tell us a little bit about what that means for us.
So most dental insurance plans have somewhere in the neighborhood of $1,000 to $2,000 worth of benefits in a year, in a calendar year. And most insurance plans reset every end of the year. So a lot of people will get a little bit of work done during the year and still have, considerable amount of money left on their insurance plan. And it does not, if it doesn't get used, it just gets zeroed out and you start over the next year. So if you have something that needs to be done, it's a good time to use your benefits, because when you start out with new benefits beginning of next year, you might need them for the year.
That is true. So what are some of the things that people should do to take advantage?
So
get that last minute root canal, or
make sure you get your teeth clean. You don't want to have anything, any problems with your holiday pictures there. Fillings, root canals, crowns, all those things. If something's kind of bothering you a little bit, I wouldn't,
don't
ignore
wait.
it. Yeah, I wouldn't ignore it.
We're so good at waiting, procrastinating. Oh, I'll do that tomorrow. I'll do that next week, and then before you know it, it's going to be a new decade.
That's
so
right.
Now you've got a new plan, though, that is actually going to help people out.
Yeah.
What's that all about?
In the world of dentistry, there's really two pools of patients. So half the population has dental insurance, and half the population does not have dental insurance. And the patients with dental insurance tend to get a considerable discount over normal fees. And then if you were to come in without insurance and trying to get the same procedure done, it would cost you considerably more in most cases. So what we did is we developed our own in-house dental plan called our Lowcountry Smile dental plan. And that's $99 a year, and it it includes your initial exam and x-ray, it includes your x-rays throughout the year, throughout the membership. And it also includes 50% off your preventive care. So if you're healthy and want to stay healthy, it's 50% off of all of that.
Wow. So that's actually pretty reasonable. Yeah. That's great. Now, we were talking about, Dr. Owen, about, just making sure that people are getting the things that they need. And let's talk a little bit about hygiene, because we also want to nip problems in the bud before they get bad down the line.
Correct.
So what are some of the things that people should be doing that could end up being something severe and requiring you to have major surgery down the road?
Right. So the mouth is the main entryway for bacteria, and there are good bacteria and there are bad bacteria. And over time, if people aren't coming in to get their teeth checked, that bad bacteria accumulates and they can develop something called periodontal disease or gum disease. And unfortunately, if that's goes without being cleaned, then it can actually get in the bloodstream and can cause systemic implications. So like affecting their cardiovascular health, or implications with diabetes, or even affecting pregnancy. So
really?
Yes.
I didn't even realize it was that serious. So it's not just about making sure you brush your teeth every single day, a few times a day, right? Is that the correct amount? What's the minimum?
Brushing twice a day, morning and evening, soft bristled toothbrush, flossing, of course, and then using a fluoridated mouth rinse. Okay,
now you mentioned something, a soft bristle toothbrush. Now, a lot of people like the medium bristle because it's a little bit stiffer, but actually I had a friend that used that. He was a little obsessive about brushing his teeth. He ended up completely tearing up the enamel on his teeth and now has pretty bad teeth. So, so is that what's recommended, is just use a soft bristle, just do it more often?
Well, soft bristles are also really good for gum health. If you use anything besides a soft bristle, especially if you're a heavy brusher, it can actually cause the gums to recede a little bit, and they end up with sensitivity, and you end up seeing the root surface of the tooth, which isn't quite as strong as that outer layer of tooth called enamel.
Now, I noticed that we were taking a shot of what we've got here on the table, and you brought with us a toothbrush, toothpaste, dental floss, always floss. I'm terrible about that. I never floss. And then this thing, I thought it was for your teeth, but it's actually a gripper that you could use for shucking oysters and things like that.
Yeah.
I thought maybe you like use it to clean your teeth. But this is a part of a little package that your new customers get when they come into Trident General, right? Okay, so kids are tough ones, tough nuts to crack. Now you won the Mom's Choice Award, so you have a way with kids, I'm sure.
Yes, so we won 2018 and 2019.
Well, congratulations on that. And you've also won an award yourself.
Yeah, we won the Charleston's Choice Award recently for Best Dentist. So
That's
I'm very
wonderful.
excited about that. Yep.
Well, that's great. Okay, so end of year dental care, make sure you brush, maybe get a new toothbrush for 2020.
Yes.
That's right. That's right.
How often do we need to replace our brushes?
Usually once every 6 months, or as soon as the bristles start to like kind of spray
Right.
out. Yeah.
When your toothbrush is flat, that's when you need to get a new
Yeah.
brush, right?
That's right.
Excellent. Now, you've got several locations around the Lowcountry. How many do you have?
5.
Five. Okay,
locations,
so
yes.
no excuses. Somerville.
So North Charleston, Somerville, Mount Pleasant, James Island, and Hanahan. So we're
Perfect.
trying to be close to everybody.
That's
here.
great. All right, we're going to have all the information on our website, foxcharleston.com. Doctors, thank you very much.
Thank
Thank
you for
you.
having us.
We're back after this.